Good morning, good afternoon, good evening, wherever you are around the world. Can I welcome you to this ISSUP webinar on substance use and homelessness, new perspectives from research and practice. I imagine a number of you have already attended the previous two in our series, which we hope will prove to be of value. But today we're very fortunate to have someone who's got some real experience of the practical realities facing homeless and particularly young people. And Dr. Alok is an additional professor at the National Drug Dependence Treatment Centre at the All India Institute of Medical Sciences in New Delhi. I won't get into the details of his CV. This gentleman has done an incredible amount of work in this field and working with this incredibly important area of concern. It's an international concern, but we hope that this particular session will allow us to get an insight into particular issues facing a particular country and particular settings and particular needs of groups of people who face homelessness. So I'm going to say little more other than say welcome and thank you, Dr. Alok, for giving your time and input and support to us in addressing this issue. We hope there will be time, more than enough time for questions at the end of Dr. Alok's input. So if you have any questions as you listen or that you have at the outset, please go to the questions session on your on the web GoToWebinar chat box and write in your question, and I will pick up those at the end and give opportunity for as many as possible to be addressed. So please do send in your questions if you have any, and we'll deal with those at the end. So once again, thank you, Dr. Alok, for giving your time, your expertise, and we look forward to hearing from you today. Over to you.
Thank you very much, Jeff, for your kind introduction. Good afternoon, everyone. I definitely would like to first thank ISSUP for inviting me to share my thoughts with you on this very important topic. We all have gone through a very tough time over the last 2 years, and I don't think there is anyone here in the audience whose life has not been touched in any way, at least in some ways, by the pandemic. And one of the populations which is actually most at risk and most vulnerable to something like this is the homeless population. So this topic is extremely pertinent to discuss at this point in time. So without any further delay, I would start with my presentation, and I'll be happy to answer any questions after that. So I'm going to speak about the situation of homelessness and substance use in India, and what has been the impact of the COVID-19 pandemic on the entire situation. So just to begin, to give an idea of what we define as homelessness, United Nations defines it much more broadly by stating that anyone who either does not have housing, or if the standards of housing are not met, then such an individual can be considered to be a homeless individual. However, when it comes to the Indian definition of homelessness, the census, which is carried out every 10 years in our country, and the last census was actually performed in 2011. It occurs without fail every 10 years, but because of the pandemic, actually the census was not done in 2021, and we are hoping that it would be done either this year or maybe next year. So the census of India, government exercise, defines a homeless individual to be someone who belongs to a houseless household, and houseless household is described as any household which does not live in census identified houses. So they are people who live in either in the open, on the streets, on roadside or pavements, under flyovers, and in places of worship. So it is a much more narrow definition of homelessness that we follow in India. Uh, uh, Globally, it is estimated there are about 1.6 billion people who have substandard or inadequate housing conditions, of which about 16 million are added every year to that. And almost 150 million individuals are homeless worldwide. Uh, Also, homelessness is also not a homogeneous entity. There can be various ways in which people become homeless. Uh, so, based on that, homelessness has been categorized as primary homelessness, which basically means people who do not have the typical kind of accommodation that we understand. So that is the sort of definition which census in India follows, where people who do not have house of their own to live. So people living on the streets or in shelters. Then there could be secondary homelessness where people have temporary shelter, but they have to switch from one kind of temporary shelter to another. So this would typically be people who are migrant laborers working in different areas of the country. And then it could be tertiary homelessness also, where it's basically people who have to live in boarding houses kind of arrangements for a period of time, usually 3 months or longer. So depending upon what kind of situation people are, they can be either primary homeless or secondary homeless or tertiary homeless. Now, when it comes to the extent of homelessness, it's very surprising that in India, the figures are much lower than in many of the more developed countries. So if we look at data from European countries or from Americas, the rates of homelessness are higher than in India. And uh, one of the possible reasons for it is that the definitions which are used to uh, categorize people as homeless, they are different in different countries. So that could be one of the reasons why there are differences. uh, and also in India, the primary source of data for homelessness is the census of the country, which takes place once in 10 years. Even in the census itself, it was found that apart from the 1.77 million people which were found to be homeless, which is 0.15% of the population, there are another 68 million people uh, who live in urban slums. So now that is a huge number. So altogether, we are talking about nearly 70 million people who either are living in very poor housing conditions or are homeless. As far as actual homeless population is considered, some non-governmental organizations actually put much higher number, so about 4 million or so. But even 4 million would be very small proportion of our population. So the other reason that could be behind these numbers, low numbers in India, is the fact that most of our population is still even today is rural, and homelessness in our country is largely an urban phenomenon. So we have, at the time of last census, the 68% of our population was actually rural, and only 32% was urban. So even though urbanization is increasing, still majority of the population lives in villages where homelessness may be an issue, but not such a big one. And even amongst urban centers, actually, homelessness as a prominent concern is there in the largest of cities. So so that's why the rates may be lower in India, because of the rural nature of our population. In fact, over the last few decades, there has actually been a decline in homeless population in India. So between the 2001 and 2011 census, the homeless population actually declined by the proportion, as a proportion of the total population, declined by about 25%, which is quite significant. And the largest of his states actually showed the largest of decline also, so which is also very significant. Uh, and another important aspect of homelessness in India is that only 1 out of 5 homeless individuals, those who get categorized as homeless in census, only 1 out of 5 of them are actually people who are homeless because they do not have a place to stay. Uh, 4 out of 5 people, 80%, are actually people who have come to a city to work and do not have a place to stay in the city, but they may actually have homes in the villages wherever they have come from. It could be in the same state, even be in another state, but they do have a place to stay there. But because they spend most of their times with it, and usually in India people move with their entire families also if they have to work for a longer period, like 6 months of the year or 9 months of the year in another city. So entire family units move, and where women are also working, and in the large city that they move into, they are usually homeless. But in another sense, they are actually not homeless, because they do have a place to stay where they came from. And about 10% of the population in India, of 10% of the homeless population in India is constituted by females. We look at the geographical distribution of homeless population in the country, particularly in the urban areas, which is where the major problem is. We find that it corroborates fairly well with the largest of cities. So we have Bombay, we have Delhi, we have Bangalore, and Calcutta and other cities. So most of these largest cities actually also contribute the largest number of homeless individuals in our country. So it is said that the 20 largest cities contribute almost 50% to the entire population of homeless individuals. Now, the second aspect of, obviously, my topic is homelessness and substance use. So um, trying to understand what is the extent of the problem in homeless populations, and why is it so. So there have been a number of studies across the world on this issue of what is the prevalence of substance use and substance use disorders in homeless populations from various areas. UK, we have Australia, in Canada, Netherlands, in US. A number of studies have been conducted. Unfortunately, in India, there has not been any such large national level study. So, but if we look at all these studies which have been done across the world, both in developing world as well as in underdeveloped countries, what we find consistently is that the rates of substance use are among homeless populations, they're much higher than in general populations. If we look at the data from US, the rates of cannabis and cocaine use are much higher than that in among homeless individuals than in general population. Similarly, in Canada, cocaine use was reported to be much higher. In UK, heroin use was reported to be almost 40 times. In Australia, if you look at cannabis use disorders, they are much higher than in general population. And that is there across the world, everywhere. Alcohol use, illicit drug use, injecting drug use, cannabis use, all of them have been reported to be much higher in homeless populations as compared to general population. This was the data for men. If we look at women also, we find the same thing, that even among women, wherever we have this information available to compare, we find that the rates of drug use and alcohol use are much higher in women as compared to in homeless women as compared to women who represent the general population. So it is very well established that homeless populations are extremely vulnerable to substance use and substance use disorders. So that is an established fact now. There has been some effort to understand the reason behind it, that why are homeless populations so vulnerable to substance use, or is substance use a contributing factor to homelessness? Because it can also happen that way, that somebody gets into substance use, goes on to develop dependence, and because of the substance use disorder and all the economic and familial adverse effects of drug use disorder, people may become homeless. So what is established is that they are interlinked, and the direct as well as indirect consequences of substance use are more commonly experienced by homeless individuals as compared to other individuals with substance use disorders. The direction of relationship is not entirely clear. Different models have been suggested. There is a social selection model, which means that substance use may act as one of the reasons or triggers for homelessness. So homelessness in that sense will represent an endpoint in the entire process of gradually declining social status and support that individual experiences when they go on to develop substance use disorder. So there is gradual depletion of financial and social resources, and eventually the person ends up becoming homeless. But there is also a social adaptation model, which basically suggests that uh, people may get into substance use because of homelessness. So homelessness by itself is a risk factor for initiation of substance use. And in India, we see this in slum population, which is not exactly homeless population as per census, but it is homeless population according to the UN definition. So in slum populations, we see in urban areas, in large mega cities, what we see is that children as young as 6 and 7 and 8 years are getting into substance use, and there it is uh, 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 due to the environment in which they grow up and the kind of role modeling, social role modeling that they experience, that they and the stresses and the lack of alternative opportunities for alternative sources of recreation, variety of factors, lack of schooling. So due to variety of reasons, children who grow up in these uh, uh, impoverished families, they tend to start substance use very early and go on to develop addiction, not just to one, many times two or three different types of substances. So in this context, homelessness may actually work as a risk factor for substance use. Now, once again, there are a number of studies which have tried to look into this relationship. They have been done in different parts of the world. They have used different types of, study designs. Some are qualitative, some are quantitative. They've used different instruments to, study this relationship. So, quite a few studies I could locate which have looked at this relationship and try to understand what are the factors behind you know high prevalence of substance use and substance use disorders among homeless individuals, and what is leading to what is the nature of the relationship. So quite a few studies. I've tried to summarize the findings into one single slide, so I hope it's not going to be too confusing. So if we look at some of the largest of these studies, what we find is that there are a number of factors which determine the likelihood of substance use in homeless populations. So homeless individuals who have poor social support or negative coping mechanisms, or have psychiatric comorbidities like depression, and younger in age, who have peer group which is of people using substances, and access to weapons, somehow living in the streets, so those do not have access to shelter services. For women particularly, those involved in sex work, having history of incarceration, once again psychiatric illness, uh, once again peer group, less education, so those who do not get opportunity to get educated, those who have been homeless for a longer duration, who have had traumatic events in life for which homelessness itself is a risk factor, and and those who have multiple sex partners. So these are the risk factors for initiation of substances and development of addictions among those who are homeless. So that is one set of studies. Another set of studies gives us information about who among what is the likelihood of homelessness among those who have started using substances. So people with alcohol use disorders, those who become dependent on alcohol, or substance use disorders. So drug dependence by itself is an independent risk factor for homelessness. If it is combined with poverty, then the risk increases. And some studies have also associated with the use of specific substances like methamphetamine and cocaine. So what we do find is that there are risk factors both ways. Homelessness leads to creation of certain risk factors which increases the likelihood of substance use. Substance use and substance use disorders, they also tend to push an individual towards homelessness. So the more current understanding is that the relationship is bidirectional, which means homelessness can lead to substance use and substance use can lead to homelessness. But the important element also here is that there are certain risks, certain vulnerabilities which actually increase the likelihood of both. So there can be certain risk factors which increase the likelihood of both homelessness and substance use. So it's a far more complicated relationship than just going in one direction. Uh, as far as the use of substances is concerned among homeless individuals, some of the factors have been identified which very clearly increase the likelihood. One is being in foster care as a child, history of incarceration, having more family members homeless within your family, living on the street, so not having access to shelter services, and having drug using peers. So these are the factors which increase the likelihood of substance use among homeless individuals, and being married is actually a protective factor. So if we look at the Indian literature in this regard, it's very, very deficient. Like I said earlier, we so far have not had a national level study on this issue. So there are some smaller studies done by some institutions here and there in some local homeless population, and largely the data which comes is from there. So as far as the extent of homelessness is concerned, we do have national data, but when it comes to substance use among homeless populations is concerned, we do not really have good quality national level data. So most of these studies, in fact, which I'm going to discuss, are not even have not actually been even done among homeless populations. They were done in some other population where homelessness was found to be one of the phenomenon that they could observe. So, for example, this was a study among people who inject drugs, and largely done to assess their quality of life and psychiatric mental health. And what it found was that almost 70% of the drug users which participated in this study, injecting drug users, they were homeless. And this was from Delhi in India. Then there was another study which studied risky behaviors among homeless individuals, once again in the context of HIV, risk of HIV transmission. And they found among homeless, nearly 500 homeless individuals, that the prevalence of alcohol use was 64%, and 4% had injected drugs regularly. So, which is very, very high. Then this is a study among delinquent adolescents in once again in New Delhi, which reported once again very high substance use among adolescents who are not living with their families. And this was a study on mentally ill inpatients who used to be homeless, and there also the prevalence of use of various substances, particularly cannabis, was very high. Now, cannabis obviously is an independent risk factor for psychiatric illnesses, particularly psychosis. So that this relationship may have been due to that. Now, there is this one study which I also was part of, actually, which was completed last year, but again a small study, only 100 homeless individuals, once again only from Delhi. But this was the first study of its kind in our country which specifically looked at the prevalence of substance use in homeless individuals. So this was done only among males, and by use of structured questionnaires and established, validated instruments, we try to study the rates of both substance use and substance use disorders. And what we found is that the prevalence is very high. 76% alcohol use prevalence, cannabis was 27, opioids were 13. Just as a comparison, we our institute also did the national survey on substance use, which the report of which came out in 2019. So we do have general population rates among men from that survey, and if we compare it with the rates we found here, what we see is that alcohol in among males of general population, the prevalence is 27%, and here it was 76%, so nearly 3 times. Cannabis, it was 5% in adult males from general population, and it is 27% here. And opioids is 4% and 13%. So somewhere between 3 to 5 times higher rates of substance use were found in this study among men who are homeless as compared to the national survey which was done in 2019. Of course, this study is only from one city of the country, and there could be India is a large country, there can be huge differences geographically and culturally, and which could lead to differences in these rates in different parts. So unfortunately, we do not really have very good quality data as far as substance use among homeless populations is concerned. and particularly for women, we do not have any data whatsoever. In fact, recently a study has been done, though not across the country, but in 10 largest cities of the country, uh, which have been picked from all different regions of the country also. So it can be considered fairly representative of the homeless population in India. However, the study has been completed, the findings have been submitted to the government, but the government has not yet taken a decision regarding disseminating the findings. So the findings are still not in public domain. I was part of the study, but my lips are sealed. Uh, Now, coming quickly, just giving an overview of the kind of services which exist in India for homeless populations. So, when it comes to shelter and other services, the largest actually scheme which Government of India runs is something called as National Urban Livelihoods Mission. Uh, uh, Under the Deen Dayal Antyodaya Yojana. So it has various components. This is a scheme which includes skill training and placement, which includes formation of self-help groups and hand-holding those self-help groups. There is some financial support also for these activities, and subsidization of credit for urban poor. So this includes grant of some amount, X amount, 2 lakhs here, as I mentioned here, for individuals, and if it is a group, the amount is about 5 times higher. And within this scheme comes the provision of shelters for urban homeless. So the cost of construction of shelters is 100% funded by the Government of India under this scheme. And then there are certain special projects for some special subsets of the urban poor. If we look at the shelter services which exist in our country, primarily we have 3 types of shelters. There are permanent shelters, so these are proper buildings, concrete buildings which exist, so they are permanently there, and which run throughout the year as shelters for homeless populations, largely in urban areas, of course. But then we also have some temporary kind of arrangements, semi-permanent or temporary shelters. And these are because homelessness in India, because largely 80% of it is migration related to livelihood. It is also a seasonal phenomenon. So in certain seasons, particularly in winters, there are far more greater number of these seasonal migrant homeless as compared to other seasons. So for about 6 months, between say October and March every year, the number increases tremendously. So at that point in time, there is this provision of setting up temporary shelters to accommodate the increased number of homeless individuals. Most of these shelter services in most states are managed by non-government organizations as a project with grant from the government. Usually these shelters only provide shelter. So although there is no cost attached to staying in these accommodations, but they do not usually have provision for food or treatment services. So if the organization is keen, they may get another grant from some other scheme where there is provision of food, or through some other source, civil society or something, and arrange for nutrition or some medical services. But usually these shelters, they only provide facilities for night stay. The challenges. So this scheme, although it appears to largely be designed to cater to the needs of the urban homeless populations, the problem is that the scale at which this scheme is being implemented. So at this moment, it can only cater to about 10% of the individuals who actually need services. So although there are some state government supported schemes as well, but they are not uniform. So you do not find those schemes being run in every state of the country. There was this sort of assessment of the availability and the status of services for homeless populations in the country, and which revealed that only about half of the homeless individuals had any sort of access to health services. So almost half did not have, and only about a fifth of them could avail nutritional support, rations to actually prepared food through the public distribution system. So what the survey identified is that nutrition in particular, was a big problem when it came to the homeless populations, even amongst those who were receiving shelter services. And of course, there was no provision for treatment services for substance use disorders. So that is practically non-existent in any of these shelter homes which run in our country. Now, some of these organizations, like the organization which we have collaborated with, Society for Promotion of Youth and Nurses, SPBIAM, it's a non-governmental, not-for-profit organization. They, out of their own initiative, have actually tried to secure some collaboration. Like they approached us, and then we started providing treatment services for homeless drug users uh, uh, in partnership with them. But in most of these shelter homes, there is no provision. So in fact, this is that initiative which we took, which we started in 2017, that we identified an underdeveloped, underserved area in Delhi, and where in collaboration with this non-governmental organization which is actually managing the shelter and nutrition services, and in collaboration with the Delhi government, which provided the building to establish these services, we started running an exclusive treatment center for homeless drug users. So our responsibility is largely to provide the clinical expertise, the clinical personnel, doctor, nurse, counselor, and social worker, and the medicines which are required to treat. So we take care of the treatment part. The NGO takes care of managing the shelter and nutrition services, and the state government actually is providing uh, the, the the building where these services are located. So this clinic has been now running for nearly 5 years, and we have registered more than 1,600 homeless drug users so far. So that's one model which has come up. In future, we hope that, because it is a collaborative model where we did not really create a new service in that sense, we already were providing treatment to drug users. We continue to do that. This NGO was already managing shelter services, and Delhi government already runs shelter homes. So we just brought all of these services together in one place, and it benefited many homeless drug users. So this is actually a very low cost model which should be replicated elsewhere. Another initiative that we started in 2019 was something which has been done in other parts of the world. It was the mobile methadone dispensing clinic. So there the bus has a fixed route, it has halt points along the route, and any person who uses opioids can come get registered and receive treatment. And this particular actually mobile dispensing clinic helped us immensely during the pandemic lockdowns, because it helped us maintain the continuity of treatment for opioid dependent individuals. Coming to the impact of the COVID-19 pandemic itself, mm, uh, I have tried to discuss it in these three subheadings, but none of these things are happening in isolation. So it affected homelessness, it affected health of people who were homeless, it affected substance use in general, and but may have affected it in homeless individuals as well. And then it definitely affected access to treatment services for everyone. So that is something which automatically gets extended to homeless populations as well. So in India so far, if we see, more than 40 million individuals have been infected by COVID-19, and it has taken more than 500,000 lives. So it is one of the countries which has been really badly hit by the pandemic over the last 2 years. And at the very beginning in March 2020, one of the harshest lockdowns was imposed in our country, which lasted for more than 2 months. So uh, the government did try to take initial mitigation efforts, but uh, ours is a large country, we can't keep people locked down forever. So we gradually started opening up, and that's when the infection started spreading like wildfire. And as a result of the lockdowns, and subsequently we have had two more waves. So we have had three waves of COVID so far, the last one in December, January this year. And with every subsequent waves, there have been further lockdowns and disruption of life, people's lives, and which has actually then led to a lot of economic hardship, a lot of economic distress, because many of the businesses shut down for a long period of time, some forever. So people lost livelihoods, people lost their homes, and many of the migrant workers suddenly had to leave for their native places. So a lot of disruption, specifically for the homeless population. And it is obviously, it is fairly obvious that homeless individuals are far more vulnerable to COVID infection than general population, whether it is due to their poor self-care or lack of nutrition, poor immunity, overcrowding, comorbid conditions, and inadequate access to healthcare services. Uh, During this period, government did try to take some initiatives specifically meant for homeless population. One was to start temporary night shelters in other places also, like community halls, and unoccupied residential facilities. So wherever the government could locate homeless populations, they tried to do that. And they also started screening for COVID in the shelter homes, in all these shelter homes. And the government also took a massive, that was a big step actually for general population also, but which definitely helped the poor population the most, which was expanding the availability of free ration to poor families under the scheme which was already running. However, there were still challenges related to adequate spacing, privacy, and ventilation. That's why it was not unusual in the early part of the pandemic to read news reports like this, uh, you know, highlighting the struggles of the homeless population of our country during the pandemic. So a lot of news reports focused on the fact that this is one population which is not really being catered to properly by the administration. Uh, In fact, there was a review also in 2020 which found out that out of 28 states that they reviewed, 16 states actually did not have any mention of the homeless population in their various administrative circulars and policies that they had released during COVID pandemic. But at the same time, uh, uh, India is like any other, large democracy with a bumbling bureaucracy. So it takes us time to get going, but once we start get going, we do actually are able to manage. We do manage to do, quite a lot. And there is this very recent IMF working paper, which brings us very interesting finding, which is that India achieved a rate of extreme poverty less than 1%, which is considered elimination of extreme poverty, which one would imagine to be linked with homelessness. So we achieved this rate of less than 1% in 2019. However, the rate did not change in 2020. And this has largely, by in this paper, been ascribed to the COVID relief package of the government of India and the state governments, which included free rations to the public distribution system. So at some level, it probably worked. And that's why the rates of extreme poverty did not change during the course of the pandemic. When it comes to impact of substance use itself, it was widely reported at the time all the alcohol shops had closed. So there was a spike in incidence of, you know, uh, cases of complicated alcohol withdrawal coming to emergency rooms, and alcohol also started being supplied through illicit channels. And whenever you buy it through an illicit channel, you obviously have to pay a premium. So the cost also increased. And some state governments actually started imposing corona tax on alcohol. And because in India the tax on low ethanol concentration beverages is higher, like on beer and wine, than on whiskey and rum kind of drinks, so it disproportionately affected the cost of those low concentration alcoholic beverages, and the sale of rum and whiskey and those kinds of spirits increased. Now, UNODC believes that trafficking of heroin and other illicit drugs into India would have decreased in this period because the chances of crossing the border decreased. However, the clinical reports in this period indicate that there was initial disruption for a couple of weeks, and followed by that, the drugs were freely available as before and largely at the same rates. Uh, Internationally, there have been some studies which have looked at what might have happened due to the pandemic on the uh, prevalence of drug use in different countries. So there is this review which reports only 3 studies which have examined the impact on drug use, and the 3 studies actually have completely different findings. One reports an increase, one decrease, and another one says it stays the same. And there is this very interesting study from 7 countries of Europe where they did wastewater analysis to see whether there has been any impact of lockdowns on use of stimulants and cannabis, and they found that there was no clear pattern of change. There is the survey among addiction treatment service providers across the world done by International Society of Addiction Medicine, online survey, where they asked for the opinion of experts on what is happening to the availability of drugs and use of drugs. And generally the impression was that there has been an increase in use of alcohol, cannabis, prescription opioids, and sedative hypnotics, which are again prescription drugs, and decrease in the use of opioids, amphetamines, and cocaine. But this is the opinion of experts and not really a study done in the community. Similarly, when it comes to access to treatment, there was another online survey done by the same organization among addiction treatment professionals, where they asked whether what has been the disruption like due to the pandemic in availability of treatment services. So uh, only half of the countries actually reported having any plan for continuity of services during the pandemic and lockdowns. And almost more than third reported a shortage of medicines which are essential to provide treatment. And 40% of the countries reported discontinuation of harm reduction services like needle syringe programs. And more than half of the countries, or almost three-fourths of the countries, reported that outreach services were also affected. In India also, there has been reporting about the difficulties in accessing treatment due to travel restrictions. And also because, including me, most of the doctors and nurses and everyone got posted to COVID wards. However, in India, very early, in April 2020 itself, we worked with the government to change the prescription guidelines for medicines which are required for treatment of addictions. And that basically the changes were that the threshold for entry into treatment was reduced, so people were allowed to take home medications without having to come daily initially, or without having to bring a family member. The dispensing duration was increased because people were finding it difficult to travel. People were allowed to send surrogates to receive medicines. So those kinds of changes were done in the dispensing guidelines. That definitely helped maintain continuity of care, but nobody can be sure that that everyone who wanted to access treatment was able to do that. There could have been some restriction despite these measures. So to conclude, we obviously in India have a large homeless population, and as we are urbanizing more and more, the problem is likely to increase in terms of numbers, although in terms of prevalence it is coming down. And we know that they are extremely vulnerable to substance use disorders and do not have access to quality treatment for drug addictions. And this problem has only worsened due to the COVID-19 pandemic. So we do need more support, more relief measure directed towards the homeless populations. And we definitely need to study the changes which have occurred in the substance use pattern and the access to treatment in a more scientifically robust manner. Thank you very much.
I hope you can hear me now. Can I just say, Dr. Alok, thank you very much indeed for a very thorough, comprehensive, and fascinating input. So many, such an amount of information, of interest, conflicting information. Interesting when you get 3 research studies giving 3 different answers. So lots of challenges and dilemmas, but I think to show that the whole issue of homelessness and its relationship to substance use is not only prevalent in India, but an international issue. And we have to learn from each other in how we can begin to address it. I would like to pick up some of the questions that have come through, but initially, can I just ask one follow-up question? If you had a meeting with your Prime Minister tomorrow and you were faced with this issue of homelessness and substance use disorders, what would you tell him were the priorities that were required to address the issue? Where would you go next in addressing it?
I think for our situation, my first suggestion would be to integrate various services. Right now, many of the services which can actually really bring a positive change in people's lives, they exist, but they exist from different sources run by different ministries or departments of the government. So there is no cohesion. One service is available here, another service is available somewhere else. So if we really want to help people access these services, we have to try and integrate them and start providing them through a single, facility, a single window. That itself will increase access to services, and then only we'll actually get an idea of where the gaps are. So that would be first suggestion. Of course, I would have many others.
Sure. And I think, I suppose, very selfishly, my background is very much in the field of prevention, and obviously there's a problem there that needs to be addressed, both in terms of the homelessness and in terms of the substance use and the interaction between those two areas. Is there anything that you would suggest we ought to be doing to put in place a more effective prevention of either or both of the issues that you've raised?
So as far as prevention is concerned, I think uh, apart from what we usually do when it comes to substance use prevention, when it comes to this population, the biggest prevention strategy is economic development. As we need to be able to provide employment opportunities, skills to these people, and if they are able to then arm themselves, live a life of dignity, then I think that would be the best prevention approach. But that is obviously something we cannot achieve overnight. It will take a long time for our country. So otherwise, something which has very recently been started by the government is we call it a community peer-based interventions, peer-led interventions, CPLI. So where we are trying to identify volunteers from these communities themselves, young people between the ages of say 15 and 20 years, and we then train them as our messengers. So we train them on what kind of so largely the program is focused on teaching life skills to children in the community, and as part of that we also try to deliver some prevention messages regarding substance use. So it was again based on a model which we were developing with SPYM, and then ultimately government has taken it up. So we are hopeful, but it is a very challenging thing to do.
It is, and just to add to that, it's interesting when you referred to the risk factors that might increase the prevalence of substance use amongst the homeless, and the one area that you said that might decrease it was those that were married. And I wonder again, if one extends the issue of why marriage, it's about having positive relationships with other people or another person that is the key factor. So how far the prevention program is focused on how one can build positive relationships is something that might be worth exploring. But I think I take your point totally about it's fine to give the life skills and to give the how to relate, but if you can't put food on the table and you can't get any income and you can't see any value in your own lifestyle, then it's very difficult to then look at how I should behave in a more socially effective way. Can I pick up one of the questions that's come through? It says, is the recent decline in homelessness between 2011 to 2021, I think it is, it says 2011, attributed to other factors? Meaning, could the decline be attributed to migration to other countries and or deaths, such as due to the pandemic from 2020 to 21? What are the factors that you would attribute to the decline that was reported in homelessness?
So one thing is, I missed pointing it out at the time I was discussing it. This decline was not between 2011 and 21. This decline was between 2001 and 2011, because census of this decade has not yet taken place. So we do not know what is the current status. So this decline was noticed in that 10-year period between 2001 and 2011. That despite there being an increase in the proportion of urban population of the country, and overall increase in the population of the country, the proportion of homeless individuals had actually decreased. So of course there could be some amount of contribution of migration outside the country for work, but primarily those reports at that time indicated that this is because of the general economic development in the country. So there are more people who are able to afford, even though inadequate housing, but some form of housing. So which has been the case. I mean, in the last 3 decades, India has brought hundreds of millions of people out of poverty. So that has been there. The impact of that on homelessness may not have been that prominent, but to some extent that has also reduced.
Okay, thank you. Another question from a listener here. It says mostly homeless people have no proper source of earnings, and most of them fulfill their needs by begging. It's being witnessed that they're indulging in criminal activities to obtain money for their substance use. What's your insight regarding this factor? So is it, I mean, I think you said only a proportion resort to begging, but is the issue of obtaining money mean more criminality? And how do they access the sort of resources to buy the substances that they're using?
So while illegal activities to actually finance substance use, while this remains a concern, uh, uh, it is actually a very small proportion of drug users. Even within the drug using population, it actually is a very small proportion of drug users who actually have to resort to criminal activity to finance drug use. As far as homeless population in India is concerned, the data indicates that most of them are actually not unemployed. Most of them are employed. 80% of them are actually employed individuals who had migrated from their place where they used to live to another city to work, to find work, and they are working there. So these are not individuals who are financially dependent on somebody else. Only 20% of homeless populations in our cities, 20% of the population of homeless individuals is actually those who are involved in either bagging or egg picking or those kinds of activities to survive. So the large proportion is actually financially independent. They are working and they are not engaged in any kind of criminal activity. And so if we combine the two, that 80% of those who are homeless are actually working and earning and supporting their own families and their own lives, and the fact that even among drug users, uh, criminal activity is actually found in a very small proportion. So if you combine the two, you find that although it becomes a prominent issue in certain communities and locations where this may be happening more commonly, if you look at it from at the level of a state or country, it is not really a very large number of homeless drug users who are committing crimes. That's not really the most prominent issue here when it comes to homeless populations.
Okay, interesting. Thank you. Further question: is there any standard model to work with homeless people who have mental illness, or is I think that perhaps opens up the question of how far is the mental illness or the impact of homelessness and substance use on people's mental health being seen as an issue to be addressed?
So as an issue that definitely it has been recognized and something which needs addressing. I had deliberately kept that out of this seminar because I felt that there is already quite a bit to cover when it comes to substance use. I had excluded other mental health issues from this webinar. I thought that that itself is a whole area. There is a lot of research in that area, and even when it comes to the impact of COVID-19 pandemic, there is a lot of material to actually read and understand what has been the impact of COVID-19 pandemic on the mental health of the entire population, and particularly of the vulnerable populations like homeless. In India, under the district mental health program, there have been some efforts to actually address mental health issues among homeless populations, but it is an area which requires a lot of work. So we have only taken some initial steps, and I would say that there has been more work on providing treatment services to substance use disorders than to for other mental health conditions.
Okay, thank you. A number of questions are around the issue of people that end up in jail, imprisoned, either as a result of their homelessness or what they do as when they're homeless, or criminal activity to obtain substance use. You've indicated it's perhaps not the biggest problem amongst the homeless in terms of people ending up in prison, but is there anything you would want to add to that whole issue of how the homeless are dealt with respect to being imprisoned? Is there any, and what is offered when people are incarcerated in prison to help them recover and re-establish themselves out of that situation?
So I consider it to be very curious. On one hand, when I say that crime and homelessness is a very minor issue, uh, at least in our country, but at the same time, drug use by itself and interaction with the criminal justice system, it's a very frequent problem. And that is because of the laws, the way they have been designed in our country, where even possession of drugs, illicit drugs, is a crime. So we every year see thousands and thousands of individuals who are incarcerated as a result of drug use, not necessarily because they have committed any other crime or because they are out on the street as a homeless individual. I would imagine that even in this scenario, it is the homeless individuals, the poorer individuals, who are more affected by this as compared to people who at least have family support and other things. So definitely, I would imagine that homeless individuals are disproportionately affected by this scenario of putting drug users in prison just because they are drug users. Now, as far as services which are available, and that is because of the lack of awareness and lack of sensitization of the enforcement agencies and also the criminal justice system. The law does have provision, but the provision, the way it is for choosing treatment over incarceration, but the way this provision is designed, hardly nobody ever chooses that, because in order to choose treatment over incarceration, the person first has to accept that he has committed a crime, which nobody does. So because using drugs itself is crime, you first have to admit to a crime to actually access treatment, which becomes a barrier to accessing treatment. So everyone ends up going to the prison. Now, when it comes to the availability of services in prison settings is concerned, it is available in very, very few places. So you may have all prisons in India have hospitals and dispensaries, but I would imagine that psychiatrists are available only in about half of them. And even where there even where you do have a psychiatrist, availability of medicines to actually help people with addictions is even there in even a smaller proportion of prisons. So we can count on our fingers how many prisons actually can provide proper treatment to people, prisoners who are incarcerated and who have addictions. In fact, most of the prisoners do not even report. Every prisoner goes through a medical examination at the time of entry into prison. Most of them don't even report they are drug users.
Okay, I'm going to have to leave it there as our time is up. There are a number of questions, and you've covered such a range of issues and shown that every issue relates to another issue in terms of this problem, both in terms of homelessness and substance use. You've given us a very comprehensive response. There are a lot of other questions I'm sure we could have spent time on. One of the questions, the final question, was, can I have a copy of the presentation that you have made, Dr. Alok? And I should say to all those who are listening, yes, both the recording and the presentation will be on the ISSUP website that you can get access to, and hopefully any questions that you have, I'm sure Dr. Alok would be interested in being prepared to reply if he can. Can I just use this chance to say thank you very much indeed to Dr. Alok for his time, for his skills and abilities, and for his energy and work in this area. It's fascinating to see just how much is being done. We can often see a stereotype of India and the slums and the homeless, but it is something we have to notice that it is not necessarily India that just has this issue. We all have this issue, and sometimes much bigger than we often think or like to pretend we have. So thank you for that. Thank you for those of you who have joined the webinar today, hopefully for all three. We welcome your membership of ISSUP, of course, and we look forward to being with you on future webinars. And so thank you very much. Thank you, Dr. Alok, and have a very good day and weekend, everyone. Thank you.
Thank you, Jeff. Thank you. Thanks a lot for this opportunity.
Thank you.